Ibuprofen is a widely used non-steroidal anti-inflammatory drug, NSAID, that is used to relieve pain, reduce fever, and reduce inflammation. In this article, we will explore the history, mechanism of action, uses, dosage, forms, side effects, precautions, and potential interactions of ibuprofen. History of ibuprofen. Ibuprofen was first discovered in the 1960s by Stuart Adams and his colleagues at Boots Pure Drug Company in Nottingham, England. They were searching for a new drug that could relieve pain and inflammation without the side effects of existing NSAIDs, such as aspirin and phenylbutazone. After screening hundreds of compounds, they identified ibuprofen as a promising candidate. The first clinical trials of ibuprofen were conducted in 1966, and the drug was introduced to the market in the United Kingdom in 1969. It was later approved for use in the United States in 1974. Mechanism of action. Ibuprofen works by inhibiting the production of prostaglandins, which are substances in the body that cause pain, fever, and inflammation. Prostaglandins are produced by an enzyme called cyclooxygenase, COX. There are two types of COX enzymes, COX-1 and COX-2. COX-1 is responsible for producing prostaglandins that protect the stomach lining, regulate blood flow to the kidneys, and promote blood clotting. COX-2 is responsible for producing prostaglandins that cause pain, fever, and inflammation in response to injury or infection. Ibuprofen inhibits both COX-1 and COX-2 enzymes, although it is more selective for COX-2 at lower doses. By blocking the production of prostaglandins, ibuprofen reduces pain, fever, and inflammation. Uses of ibuprofen. Ibuprofen is used to relieve mild to moderate pain, such as headache, toothache, menstrual cramps, and muscle aches. It is also used to reduce fever and reduce inflammation in conditions such as arthritis. Specific uses of ibuprofen include headaches. Ibuprofen is often used to relieve tension headaches and migraines. Menstrual cramps. Ibuprofen is effective in reducing menstrual cramps and can be taken before or during menstruation. Toothaches. Ibuprofen is commonly used to relieve the pain of toothaches. Arthritis. Ibuprofen can reduce inflammation and pain in conditions such as osteoarthritis and rheumatoid arthritis. Fever. Ibuprofen can reduce fever in both adults and children. Dosage of ibuprofen. The recommended dosage of ibuprofen varies depending on the patient's age and weight, as well as the reason for use. It is important to follow the recommended dosage instructions on the label or as directed by a healthcare provider, as taking too much ibuprofen can cause stomach ulcers and bleeding. The maximum daily dose of ibuprofen for adults is 3,200 mg per day. The maximum daily dose for children depends on their age and weight. It is important to use a proper measuring device, such as a syringe or measuring cup, when administering liquid ibuprofen to ensure accurate dosing. Forms of ibuprofen. Ibuprofen is available in various forms, including tablets, capsules, liquid, and topical gel. Tablets and capsules are taken orally, while liquid ibuprofen can be taken orally or administered through an intravenous IV line in a hospital setting. Topical ibuprofen gel is applied directly to the skin over the affected area and is often used to relieve pain and inflammation in conditions such as arthritis.